Yeah, I'm not so familiar with Teams.
No, you are professional. It's okay.
I
Working
hope
fine.
it
Yes.
work.
You can press the slide mode, the presentation mode.
Yes, but now
That's
I
it.
cannot see you. Uh,
If you press the presentation mode, you will not be able to see the participant.
oh,
But we can see
when
we
I
can see the
present,
presentation now. It's clear.
I cannot see you in the same time.
I believe if you are using the presentation mode, you cannot see the participant.
Okay, okay.
Yeah,
Uh,
you need to maximize the teams.
yeah,
But I believe it's okay. Yeah, we can see the presentation now. You are
you see
using
now.
Mac.
Yeah, I'm using Mac.
Because of that.
Yeah, that's why it's a bit more complicated.
Yeah, yeah.
So do you see presentation mode
Yeah,
now?
yes, yes, yes. Now, no.
Now, no. Okay,
Press it again. Yeah,
okay,
it's okay. Yeah,
okay.
yeah,
Okay, so I can just hear you. I cannot
yeah.
see you. But I do have some points that I'd like to
Sure,
stop and see you. So I'll try
sure,
to
sure,
manage it in
sure.
between.
Yeah,
I'm going to talk about precise and personalized medicine in autism and developmental disorders. I'm a professor at Tel Aviv University and a medical advisor for Maccabi Healthcare. And I wrote here my emails. If you'd like to communicate afterwards, please feel free to. Uh, I will answer any questions that you do, and I'll try also to give time for questions at the end of my talk. And thank you for inviting me. I'm very happy to
most
be here.
welcome.
Some
Same
of
here.
my disclosures, I founded two centers, one at Tel HaShomer and one at Volson, together with Maccabi, and I was the director of a developmental center at Chiba Hospital. The Keshe centers are a model that I developed for intervention for children with autism. I also was involved with some of the pharma studies that I mentioned here. And I'm involved with the submission that is related to one of the studies that I will mention here for Horizon in Europe. I'm besides Maccabi, I'm also a medical advisor for a device called Little One, and also I was part of a team that established the first autism center in Cyprus, and their endeavor that I'm very proud of, that it's already working and provides services for all children in Cyprus. And I also am related to the Fragile X Parents Association that I advise them on Fragile X, which I'll also talk during this discussion. But just to start, and we're all using precision medicine and personalized medicine, that it's mainly now related to oncology. But we're starting to use this term and this type of approach for many other disorders besides oncology. And the definition of it is to enable risk assessment, diagnosis, prevention, and therapy that is specifically tailored to the characteristic of each person, and enhancing the quality of life and public health for all people, but by looking at what are the specifics of the disorder in one person. So just to start with an example, uh, uh, this is a picture for an ultrasound of fetus. It's at about 24 weeks of pregnancy. And during the ultrasound, the OBGYN is telling the parents that you have a boy, and this child is at risk of having 15% of learning disability, clumsiness, and ADHD, attention deficit disorders. he's at risk of having 2.5% of severe disability like autism, intellectual disability, and cerebral palsy, but only if he's born at term at 38, 40 weeks. If he will be born before time, then it's a risk of 70% of mild disabilities and about 1 to 10% of more severe disabilities. So what I wanted to ask you, and I will close the sharing for a moment, what do you think, in your opinion, the OBGYN saw in this fetus? What kind of finding he saw that is telling about all those risks? Just to guess, what was the finding that he saw on ultrasound? Any guesses?
Yes, Ramiz.
It's like there is something in the brain.
Yeah, I think so. He saw something that is unusual in his face.
Don't think about the picture. I didn't
Okay.
give any. I didn't
No
give a.
picture. So we have to take to look at the 70% or something like this.
No, if he's born on time, it's about 15% risk of mild things and 2.5% of severe things. If he's born before time, like premature, then it's 70% risk of small problems and 10% risk of big problems.
I think he saw not a specific one thing. So maybe statistically, all these things together will make this kind of disorder.
I didn't hear your last word.
I said that I think they saw multiple small things, and these multiple small things statistically will make these disorders together.
Any other guesses?
Is this some kind of the disease? Because there are some diseases when the final trimester of the child, when he finish born, it happened to him. So to prevent this, it gave him a premature birth or something like this.
Okay, so I'll give you the response. So what was seen on ultrasound was nothing. This baby everything is fine. So when you're looking at a baby before he's born, when everything is okay, that's the regular statistic. Any child, he has 15% chance of small problems and 2.5% of severe problems. And if he's born before time, he has many more risk of problems. So think about it that in any normal child that is born, he's already has this risk up front of having, that's the population risk, that's the regular risk that he's having. So you have to take into account that's the risk for any newborn. And if he's born before time, if it's preterm, the risks are going even higher. So just to go to the statistics, if you're looking only at autism, on the left side, you can see the growth in the likelihood of autism in the world, in the general population. We're now talking in about 1 in 36 children that have autism, sorry. And here is the data from Maccabi that you see it's about the same. We now have about 1 in 50 persons with autism at the Maccabi. So we have the same statistics like all over the world. So those are the chances for any child or any person to have autism and also many other disabilities. And just to talk a bit about what are the signs of autism, they are labeled in a book called DSM-5. That's a diagnostic manual that lists all the signs. And the signs of autism are social problems in communication, in developing and maintaining relationships, but also atypical behaviors like repetitive behaviors, routines, rituals, restricted interests, unusual sensory responses like sensitivity to smell or to sand or to water or any other sort of sensitivities. So if you look at those characteristics, those characteristics you can find in many people. But in addition to those characteristics, those signs have to be present in early childhood, but sometimes you see them only later on. Sometimes we diagnose autism in an adult or in a teenager, not only in childhood. Those characteristics need to cause an impairment of function, like the person is not functioning well. And also, they have to be more than intellectual disability, because we have to decide whether it's more intellectual disability or more autism, because those disorders many times come together. But when we look at autism and all those signs, and you know that it's called autism spectrum, it's actually many disorders that have these shared features. But when you look at persons with autism, you can see that each one is different. So I'll give you some examples. For example, a baby that was born premature at 27 weeks. He didn't have cerebral palsy or intellectual disability, but he has high functioning autism. And that's one example. Another example is a person that I think all of you know about him. He has absent corpus callosum, and he has very special talents with numbers and memory. He died a few years ago. His name is Kim Peek. And let me ask you why I say that I think most of you know about him, because there is a very famous book and movie about a person with autism that is based on this person. His name is Kim Peek. So can you think about a book or a movie of a person with autism that is very talented with numbers?
Yes, the one who adopted someone and he starts see a number when he see any number and figure out something like this. The Brad Pitt, I think. No, not the Brad Pitt. Let me see.
Yeah. Well, when he's gambling, remember, in Las Vegas? Yeah.
Yes.
That's a movie. It's called Rain Man. It's a movie that is based on this person. His name is Kim Peek. And he has these special talents of being very good with numbers. But if you remember, he was very low functioning. He couldn't dress on his own. He needed help with food and many other things. So the fact that he has a special talent doesn't make him a person that is functioning. So that's this person. His name is Kim Peek. And when they analyzed his brain, he had absence of the corpus callosum. That's the part that it's connecting between the two hemispheres. Another example is of those two teenagers that they have autism and they don't speak at all. They don't have any verbal language, but they're very talented in playing the piano. And what's very interesting, that they can play together, which is very complicated in music, to have people like playing in synchrony with each other, in spite of them not being able to communicate. Another example is this girl that has a very severe syndrome called Coffin series. You see that her face is a bit unusual. And she's also with autism, motor problems that are part of this disorder. Another example is another very rare syndrome in this child. This has a syndrome called ADNP, which is causing intellectual disability, autism, hypothyroidism, and problems with growth. And another example is this guy. He wanted me to show this picture. By the way, they approved showing these pictures, but don't take pictures of them, but just they approved for me to show it during the lecture. And he has IQ of 49, which is half of most people. He has autism. He's almost non-verbal, but he was able to like work for the army, and he got some prize, and he's very proud about his functioning. And he's now 30 years old, and he's able to live on his own with very little help from the surroundings. So even with very severe problems, you can adapt and reach some better functioning and independence. And the reason that I'm bringing those examples, that in spite of those shared problems that I showed, each person with autism is different. And this person, Dr. Stephen Shore, he's a professor in education. He has also autism. And he said in one of his lectures that if you've met one person with autism, then you met one person with autism, meaning that each one can be different. And the main questions when we're researching autism are what are the signs? How can we diagnose very early? What signs are more hidden? We call it camouflage. Like there are people that we don't see the signs so easily. Why is this increase in incidence that I showed you before, that it's like exponential growth? It was 250 about 20 years ago, and now it's 1 in 36. So it's growing very fast. And another question is, what are the causes? Whether it's something that it's nature, or it's something that it's environmental, what we call nurture. So I will start with the first question that I think everybody is asking. Why do you see this increase in the incidence in the prevalence of autism? So the first reason that we have broader diagnosis, like people that in the past were called like very shy or awkward or different, they're now being labeled as being with autism. And also we have broadening of the diagnostic criteria, so we can say that they have 2 or 3 things together. In the past, we were not allowed to say we had to have one diagnosis, but now we can say they have also autism and intellectual disability and ADHD and other things. So it's okay in terms of diagnosis to give a few diagnoses together. We're now better in assessing cases, especially women, and I'll show you some clues about autism in women. We have better tools and better training of the clinicians. We also have more intervention and services. So people sometimes, when they have a child or a teenager with a disability, they will get better services if this person will be labeled with autism. And if he's labeled as intellectual disability, they will have less services. So those are the laws, and sometimes it drives also the diagnosis. But besides all those reasons that are kind of something that we manufactured by better diagnosis, there are some reasons that we really see the rise, that it's real. Like I mentioned, prematurity. Many babies that are born premature are now being recognized that they may have features of autism. There is also a link that was found with the age of the fathers, like older fathers will have more children with autism, and also some other events that happen during pregnancy and at birth, like complications and medications that we give during pregnancy that were found to be teratogenic and causing autism. And there was a question about IVF treatments and autism, but we recently published a study that we showed that we don't find any link between IVF treatments and autism. But what I want to emphasize that it's very important, there is no association between autism and immunizations. So it's good to give vaccinations because it prevents many severe disorders, and it's not linked to autism. Just to show you what are some of the reasons that we know about, and if we're talking about autism spectrum, sorry, I don't know, it moves backwards. If we talk about autism spectrum, as I said, there is some overlap with intellectual disability. What's called before mental retardation, we now call intellectual disability. So there are people with autism that have also intellectual disability, and there are people that have autism with normal intelligence. And also there is a higher prevalence of epilepsy, both in autism and in intellectual disability. And during the last decade, when we do a lot of genetic testing, there were revealed many genetic causes for autism. So just to look at all the different syndromes, I don't know if you heard any of those names, but many syndromes, Fragile X, Rett syndrome, Angelman, even Down syndrome, they're all maybe linked to autism and intellectual disability. But besides all those genetic syndromes, there are also other reasons, like I mentioned prematurity, viruses like rubella, like we all get immunized for rubella to prevent the severity of rubella during pregnancy, which is causing very severe problems, including autism. Any insult around the birth may cause autism. And also what we need to be very aware is of fetal alcohol syndrome. Is a syndrome that is caused by drinking alcohol during pregnancy. And let me ask you a trivia question. How much alcohol is allowed to drink for women during pregnancy?
Zero.
Zero.
Yeah, total
Zero.
Okay, so nothing, because we don't know if one glass may cause something, or binge drinking, or drinking a little for a while. We don't know what the damage, so it's zero amount, which is very important to know in terms of prevention. So when looking at all those causes that I mentioned, when we look at genetic causes, studies have found many genes implicated both in autism and intellectual disability, and many links between those genes. I will not get into all those mechanisms. It's just a nice picture. But the reason that I'm showing that there are so many genetic disorders, that those findings of genetic disorders as being causes or many causes of autism, it brought a lot of innovation and new hope that maybe in addition to caring for people with autism and providing them intervention, maybe we can start now thinking about cure, which is a very novel concept in both intellectual disability and autism. And when talking about hope, I have to mention the hostages that we hope to bring them back. And if you look back at the diagram that I showed you before, all those disorders that I labeled in white are disorders that somewhere around the globe there is a laboratory that is working on a genetic-based treatment. So by knowing what is the genetics, what is the mechanism, researchers started to look at treatments, targeted treatments for cure for those specific disorders. And of course, by trying those in the specific disorders, they are thinking maybe it will help in some additional disorders linked to autism. So we're now moving from the era of interventions, which are very good and very important, to maybe thinking about medications that may bring more relief in addition to the intervention. But if any of you is involved with any pharma studies, I have to give you this example, which is very important, that just to go back a bit to this diagram, in Fragile X, you see that I made it like a very big label because there are about 20 or 25 drug trials for Fragile X. Fragile X disorder is a disorder that is causing autism, intellectual disability. It's very severe. And we know a lot about the mechanism. So there are under development many medications that are under clinical trial. But after the first medications that, to tell you the truth, they worked very well in mice and in animals. But when they tried it in children, all of them failed. And they all failed because there was a lot of placebo effect. You know, in all those studies, they have to be randomized. So we give either the drug or the placebo. And the placebo caused 40% improvement. And the drug could not prove more than 40% improvement. So it was like the same like placebo. It doesn't mean that the drug didn't work, but it didn't cause so much improvement. And it was a huge disappointment for all of us that we saw this placebo effect, because you may think that if the child has severe disability and his autism, then it doesn't work that you give him placebo, but it's not true. Only by participating in those studies, it was already causing a placebo effect. So there was this article that said an experimental drug bitter end. So, and they thought maybe it's going to end all those drug trials that were very novel and very experimental. But the parents said, we don't care. We want to continue and participate in those studies. Our children improve. Also, my patient said the same. Our child improved. I don't care if he improved because of placebo or he improved because of the drug, but he improved by 40%. So we want to continue and participate in more studies, which is from a disappointing, taking us to maybe more expectations for more drugs that will be more effective. So I'll just take a break for a moment before moving to another type of big data studies. And if you have any questions for this part, and then we'll discuss a very different type of studies, because those studies are on very, very few patients. And now I'm going to talk about big data. So do you have any questions?
Any question? Yeah.
So you're all with most of with closed cameras, so I cannot see your expressions. Okay, so we'll move on to the next topic. When I'm going to, but
افتحوا الكاميرات افتحوا الكاميرات رجاء افتحوا الكاميرات
sorry.
לא, בסדר, אני מדבר אליהם, שיפתחו את המצלמות. תודה.
Okay, that will be very good if you can open the cameras. Thank you. So we're moving on to a different type of research that I was involved with and I'm still very interested in. Those are studies that are big data studies. You know, at big healthcare like Maccabi, we have like a Luna Park of big data. We have very good data in the charts and we can make a lot of research based on big data. When looking at big data, you can also model by machine learning and to think about new things that you can find in this data. And the issue that I'm studying, and I hope this will wake you up because the topic starts with sex, and what I'm trying to see if there are sex differences between girls and boys. And that's the main that's the main topic that I will ask you about. And now you have to open the camera because I want you to vote, okay? And I want your opinion. If you think that sex differences between women and men, if those are genetic, they are determined before we're born, or it's something cultural that we give like pink dresses to the girls and blue pants to the boys and cars to the boys and dolls to the girls. If it's something that we're raising our children to be different, or it's something that they're born this way. You cannot say both. You have to say either one or two. Okay, so I want you to vote. How many of you think that the differences between men and women are genetic, mainly genetic?
Nice.
Okay, so how many vote one? You can raise a hand, or I don't know on Teams how you can vote, but
For
One
one,
is a genetic, yes.
just say yes. How many of you vote one? That the main differences between men and women are determined by genetics.
You mean by using colors, either pink or blue?
Okay, that's a good idea. Okay, so so if you think it's genetic, not pink or blue because it's boy and girl. If you think it's genetic, use yellow. If you think it's environmental, like the way that we're raising the children, we're determining if they're more boyish or more girlish, then vote with the color green, okay? So yellow for genetics and green for nature.
Where to choose the color? Because I am not used with the teams as well. I don't like
the chat.
teams.
Maybe you can use the chat.
Should we type it? Should we type the yellow or green, right? Is that true?
Yeah. Chat.
Okay.
On chat.
Okay.
يلا. Just type the color, yellow or green. Rames, what do you think?
That's actually a good question. It's just so hard. Like I'm not sure if I should vote for one.
You cannot say both. You can say which one is.
Okay.
Yellow or green.
Yellow is the culture and green is the genetic, right?
No, yellow is the genetic, green is the nature. Is
yellow for genetic.
The way raising the kids.
Yeah, I believe yellow. I'm not sure. Go for green.
Okay, Jafar, you're counting.
Yeah. Interesting.
I love how he colored it green. Good job.
Yes, he's a technical person. Is green.
He start know how to use the teams, Zafir.
Yeah, as Jafar said, I am a technical person, so it's not
Okay,
that hard to find out.
So let's leave the technology. Just raise your hand if you think genetics. So let me see how
Dr.
many
Ismail,
hands.
what do you think?
I think it's genetic.
It's genetic, yellow?
There aren't many cameras that I cannot see.
Genetic. Yeah, it's
So
genetic.
I believe
I think
only
we should
Ramiz
raise the
and
hand. It would be easier for you to count.
yeah.
So I'm
Okay,
just gonna raise
raise
my
the
foot.
hand for genetics.
Genetic, yes.
And now raise the hand for nature, like for the way that we're raising the kids. How many people think that we're influencing if they're more boys or girls?
It seems except Zafir and Ramiz, the rest are yellow, genetic.
Okay, so it's a bit of more, I think, for yellow, but there are some greens. Okay, so let me return to the talk because this is the main topic that I'm going to present.
I feel you're gonna surprise us right now.
Exactly.
I think I'm going to surprise both sides.
Oh my
I
God.
think so.
So just to show you, then those are some of the studies that are related to this topic. I belong to a consortium. It's called Apex Consortium in Cambridge. It's led by Professor Simon Baron-Cohen, and it's founded by a foundation called SFARI. And that's what we're looking at, differences between boys and girls and how is it linked to autism, because autism is 4 times or 3 times more common in boys than in girls. So the reason that we're studying this, that why is autism so common in males more than females? Okay, so that's the question that brings me to these sex differences. So that's just for fun. We know that there are differences. Okay, there are differences between boys and girls, between men and women. And some of those differences are what we call stereotypical, and some of those are real, like men are stronger, right, in terms of physical differences. And we're looking at development, the question that I asked you, whether those ways.
Disconnected?
She disconnected.
Yeah. Prof Lydia وأنا unable to hear you. لو فصل عندها. بروف ليديا. شكله عندها مشكلة.
عند المعلومة المهمة نقطع.
عند المعلومة اللي يعني المفاجئة.
عند المفاجأة.
عند المفاجأة.
عاد أنا بستنى يلا فاجئنا.
في تفاجأت بنفسه.
اليوم مع الاي اي كله مفاجآت ابو يسار.
فاجأت حلوة.
شكله فصل من عندها هي. الموضوع والله هذه معلومة جديدة انه عند الذكور اكثر نسبة التوحد.
شايف
مظلومين
أول مرة الصراحة بعرف.
معلومة جديدة تماما.
ومع هيك مش خالصين.
احنا لازم نطالب احنا بالمساواة يا ظافر مش الستات. جرب احكي معهم.
Hi.
Hi.
Do you hear me? Yes. Something happened with my connection. I don't know what happened, but
The answer,
okay.
because of the answer, it seems.
Yeah, probably the computer was shocked.
Exactly.
Okay, so let me, sorry about that. Let me share again.
Yeah.
Yes.
Directly to the answer.
Yes, so I don't know how much you heard me. Let me see.
It stopped from the first time that you shared the slide. The boy and the girl. It stopped there.
Oh, it's up there. Okay, so it's I talked a lot on by my own. I'm sorry.
All across finger and getting the answer.
Yes, it's not an easy answer. Okay, can
you stop there? Yeah.
Sharing now?
Yeah.
Okay, so what I was asking you. 1 second.
You can start from this slide. Typical develop. Exactly.
If this fact that boys play with more mechanical toys and girls more with dolls and kitchen, if it's something that's the way that we're doing it, and if it's genetic and predetermined, or it's something that we're causing those differences. And I was starting to bring you some research that is very, very different. It's not only medical research, it's research from about evolution. So when looking from an evolutionary perspective, when people were like having to hunting for their food and to look for their food, and women had to protect those children from like wild animals and all kind of dangers. So women became more risk aversive, more protective, more cautious, and with better social skills because they were protecting their children together like in a tribe. And the men that had to go hunting for food were more risk-taking, more impulsive, and with better visuospatial abilities. And this probably in the evolution determines some of those differences. Also, we know when children play, girls are more caring, nurturing, more cooperative. They play together. And boys are more involved in competitive play, in athletics, in physical, and in rough play. Also, women have, when you test school results, you see that girls usually have better communication skills, and boys have better problem solving skills, and they're better in specific mathematics tasks that require visuospatial skills. I don't know if there was a research about it, but my feeling is that women rely more on ways than the men. They were like, it took them longer time to rely on ways, and they're trying to find their way easier. There is also in the Bible something that is discussing about women having the wisdom of the heart in their hands, like probably referring to it, the women are more social. And this brought Professor Cohen, that I'm corroborating with him at Cambridge for many, many years ago, to make a theory that was that women are more empathizing, that they have a higher level of empathy, and men are more what is called systematizing, that are better in systems, in like understanding processes. And he did it with all different tests, and he showed it in adult people, those differences. But then he asked the question, whether those differences are present from birth, or it's something that we're nourishing it by the way that we're educating differently girls and boys. So the questions that he asked: when does it start? If those differences are genetic or they're cultural and reinforced by learning, and if we can change those differences. And that's one picture that to demonstrate one of his studies that is very famous because it was published in Nature. It's a very interesting study that examined babies that were born from the first days after they were born, for the first weeks, and he looked if where their gaze is more towards the mobile, the toys, or more towards a person that is caring for them. And that's a picture of my son. He's now almost 34 years old, but this is when he was 6 weeks, and I captured his first smile, and you see he's looking at me and not at the mobile, which is very nice, and I was very proud of it. But what Professor Cohen showed, that boys tend to look more at the mobile than at the person, and girls tend to look more at the person than at the mobile. So even in the first weeks of life, the gaze preference is a bit different between boys and girls. That's a new study. That study was published more than 25 years ago, and it made a lot of noise around it. And that's a new study that was published. I was also participated in this consortium that was looking at differences by MRI at birth. And it showed that there are differences not only in the size of the brain of newborn boys and newborn girls, but also there are differences in different parts of the brain, that some parts are more developed in girls and some parts are more developed in boys from the day that they're born. There are also additional supporting evidence for those differences. We know that the brain, when it starts to develop, it develops as a woman brain, the female brain. And when the Y chromosome starts to work, the Y chromosomes determines production of testosterone, and the testosterone is changing the brain to become like the male brain. And those differences happen already in uterus during development, and it's both genetic and hormonal. And also we know after the birth also the effect of the hormone called oxytocin that increases bonding and emotional response. So there are genetic differences and epigenetic differences that determine those sex patterns. So that's a lot of evidence that I brought you for all those that showed yellow. But I want to show you some evidence for those that voted green. There are also differences that are trying to study cultural and gender bias that we impose over our children. And one of the very nice studies looked at the way that us adults are talking to girls and the way that we're talking to boys. And if you have small kids at home or grandchildren, try to think about it. And what the study found, that first, to girls, we're talking more. With boys, we're less talking. With girls, we're using more emotional language, more encouraging, and more complimenting about appearance. Like when we first meet a girl, usually the first thing that we say, wow, you look so nice, your dress is so nice. We're using adjectives and we're complimenting. When we talk to boys, we usually are more directive. Do that, don't do that, be strong. We give commands. And when we compliment, we usually compliment about skills, like how nice you jump, show me how strong you are. And when we ask questions, we ask more yes/no questions. So this way we educate girls that they have better language skills because we teach them more advanced language. And we educate boys that they have stronger problem-solving skills because we give them this type of yes/no questions. So we're also kind of reinforcing those differences in the way that we talk. And why I'm showing you those differences in relationship to autism, in 2003, Professor Cohen published an article that caused a lot of noise, and it was in Newsweek. And he said that autism is actually an extreme of male brain. So if boys are more systematizing, they're better with math problems, they're more trying to fix things, and girls are better with empathy. So autism is an extreme, like people that are very systematizing, very repetitive, and they have less ability for empathizing with other people, and less empathic responses. And he showed the same type of research that I showed you in normal boys and girls, that it goes to an extreme when we're looking at children or people with autism, also the way that we speak with them, and also the hormonal influences. So this study made a lot of noise, but what he wanted to say that autism is actually something that is people that have like very good skills in some things, and they have not so good skills in terms of emotional, social, and empathy. And just to show you the numbers that I mentioned before, the prevalence between boys and girls. So in the past, it was 1 girl to 4 boys, but this is changing. You see the rise in both, the rise is both in girls and in boys. They all are rising in prevalence, but it's changing. It's now 1 girl for 3 boys. So we're kind of better recognizing girls with autism than we did before, but still this is a disorder that is more common in boys. So it is predominantly a disorder of boys, and girls are usually diagnosed later, and many times they have better skills. And just, I think we're running out of time, so just to go over like more big data studies, we took all the data from Tipot Halav. Those are many charts. It's 800,000 charts of children. And we looked back what kind of features may present later on as features of autism. And we found very strong parameters that are very easy to detect. Like first, being a boy, there is more risk for autism, advanced parental age, overweight, higher head circumference, children that are born through C-section, having a family history of a relative with autism, but also developmental milestones already at 1 year, that if a child is failing them, they're linked with higher risk with autism. But when we looked at girls with autism and boys with autism, they kind of were very, very similar. So typical girls are different than typical boys, but autism presents the same in boys and in girls, but it presents more in boys than in girls. And just to wrap it up, besides all what we learned from big data, we have to remember that many of those disorders have some ways of prevention. So we need to take into account the things that we can prevent. Of course, there are many things we cannot prevent, but we can prevent, we mentioned fetal alcohol. We can prevent carrier disorders. Fragile X in Israel is free of charge to be examined in all women at care-bearing age. So all women can check for carrier for Fragile X. So it's very important to examine for carrier disorders. Immunizations are good for prevention. And if we don't prevent, it's better to diagnose early on, because then we can intervene. And also we can prevent things that can happen during life, what is called comorbidities that can occur later on. Also, we can do better with treatment and prevention. But of course, we have to look for those disorders and advise the parents and advise the families, because we already have many tools, and maybe in the future we'll also have genetic tools to try to help those people with disabilities. And just to summarize the male to female differences, and as you understood, there are also genetic implications, and also the way that we're caring for the children. So it's a combination of both answers. But male and female brains are different. The sex-related brain differences, they start even before the children are born. Male brain is more sensitive to autism. But when we look at autism in males and females, they have similar features. And I like very much the phrase of this woman. I don't know if you know about her, but look for her. She has very interesting TED Talks. Her name is Temple Grandin. There is also a very interesting movie about her life. She's a person with autism. She's in her 70s now. And she has 2 doctoral degrees, one in autism, one in engineering. And she's living with autism and giving talks about it. And she said that the world needs different kinds of minds. So I think it's a very nice and powerful phrase. Sorry, it goes back. And I will finish here and thank all my collaborators from Israel and from abroad, and from the many centers. And of course, as you know, it takes a village to raise a child, and to do research, you need a lot of collaborations, and only in this way we can promote the lives of people with disabilities. So thank you, and I'll stop the share, and I'll give you some time for questions.
Ramez, what do you think? Thank you. Yes, Ramez. Any question?
Actually.
Again, Ramez?
It's a complicating topic about autism.
New info.
Interesting. Yes.
It's complicated, but that's what made me go in this direction in my career, because there are so many questions.
Yes.
So when you have many questions, then you have a lot to do about it. There is a lot of technology, a lot of innovation in it. And also there is something for your satisfaction that you're doing something for people with disabilities. I think that's very important.
Any questions here?
Could I ask one question?
Yeah.
Do you think that the neurotransmitters in the brain play a role in autism?
Yes, they're very, very important. I think that's the main cause of autism is chemistry, it's neurotransmitters, because we didn't find any like anatomical differences. And I didn't get into it, but I'm doing a research on medication that is based on a neurotransmitter called acetylcholine. So that's something to think about it, because it's very important in the pathogenesis, but also in terms of treatment.
Thank you.
Welcome.
I have a question.
Yes.
Please.
Although I don't have any medical background, but I have a question in mind related to medicine. Is there a way to prevent being an autism in the period of pregnancy before giving birth?
So there are little things that can be prevented, like checking for genetic disorders, not drinking alcohol, taking vitamins like folic acid, and like all the good care of pregnancy. But no total prevention yet.
So you cannot guarantee 100%.
Can do some things, but still there is a high chance, like I said, 1 in 35 pregnancies that there will be a baby with autism.
Yeah, and you mentioned that the chance for men to be autistic, it's 6 to 1, I think, or less.
It was
so
5 to 1.
The general population
is the structure of the brain of the males is
1 in 35, but it's 4 times more in men like in women. Like if it's a boy, it's like 1 in 32 boys, and if it's a girl, it's 1 in 50 or 60 girls. So there is more chance, but still some girls are more disabled, so it's very hard to choose the other disorders.
Yeah, but
I do have a question too, after Sazafat, of course.
No, it's okay.
Yeah, go for it.
Please go ahead.
No, I was just wondering, because like you also mentioned about like how in boys it's more common to be diagnosed with autism, but I also like thinking, I don't know, I read once that girls it's hard sometimes. I don't know if there's, I think, stages of autism. If I'm not wrong, please correct me. And it goes unrecognized at some point. Do you think that there are like specific like signs that we could or like most common that is seen in girls than in boys, like the typical signs?
Yeah, that's an excellent question, and that's something that we call camouflage, like masking. Like women are better in like hiding their symptoms of
hiding
autism.
Things. Yes.
Yeah. For example, one of the signs of autism is special interest. Like boys will be interested in dinosaurs and maps and the capitals of the world. That it's very weird. So
different.
But girls with autism will have special interest, like in TikTok, or dressing nicely, or having their nails done. So it kind of seems like more appropriate. So you kind of don't pay attention that it's also unusual, and because they're too much into it, but it's kind of special interest that we kind of accept it more commonly. So this way girls are better in like hiding their symptoms.
So it's harder to recognize.
It's harder to recognize, but when you look deeper in girls, they're like they don't understand the social things. They sometimes say things that are inappropriate, and they're like special interest, even if it's like more common, it becomes like a big obsession. So like I have it 12 years old girl coming dressed like a princess with a crown. So it's not appropriate for a 12-year girl to dress like that. So they also are awkward, but it's in a kind of a more usual way.
Oh, okay. Sounds good. Thank you. Thank you.
I have a question. How do you think about the new modern life effect?
The
The new modern life affect the autism?
that's a question for like another lecture.
Because
So I think
which better is life for them? Which was
I
or
think
what now?
I think the modern life it's easier for people with
Really?
autism
Why?
because if they're high functioning, I'm not talking about those that don't have language, but those are high functioning. They're much better with computers, with not personal approach, but like connecting through social media. They're better with like all those games that kids are playing online. So that's their way to communicate. It's like easier for them than to communicate in person. Also, it's something that they learn very easily, and I have many patients that they're very young and they learned English much better than Hebrew or Arabic. Like they're from this, like using computers and using those games, they're learning English perfectly. So this kind of better for their skills. Also, if it's harder for them to communicate in person, when they're doing it through the screen, it's easier. Because it's like when we're now like we're not so aware if the person is using eye contact or smiling, or it kind of what we kind of use differently the screen. But those things are kind of easier, and also it's easier for people with autism now to find a profession that fits them.
But you don't think, sorry, but you don't think this is a very danger for them to communicate with too much technology? Because
Yeah,
that we will learn about technology is gaming and everything. This damages the brain. So
that's true.
we
It's
have to damage the
dangerous,
brain and we give him
but
more damage.
yeah, they become like more addicted to screens. That's true. But when they're children, that's something that the parents can manage. And I tell the parent, if they're with the screen, they're losing communication. So you have to know that each time that they're with the screen, they're not communicating. So in terms of treatment and learning, we're telling them no screens. But if you're talking about teenager or adults, it's easier for them. Of course, we need, when we work with them, we teach them how to communicate in person, because if they want to interview, if they want to find a job, they still need some basis of communication. But I think in general, life is easier. Also, I think there is less stigma now and more acceptance of people with autism. And many companies, I'm involved with some like technology startups, and some of them are actually looking for people with autism to work with them, because they're very good with data, they're very good with programming, they have some special skills that it's like helpful.
Prof. Lydia, is it okay for more questions?
Sure.
Yeah. Rai? Yes, Rai.
Good
Pardon,
evening.
Bob.
Yeah.
I'm sorry I can't open the camera for
It's
today's
okay.
lecture, but I want to add up as an occupational therapist. At the beginning, I'm in the coaching field, But at the beginning, I have an experience of 6 to 9 years at Child Development Center with different categories, but I worked with autism and with Ifhonim Mishulavim. And when we sit with parents to give them the diagnosis, it was very traumatic for parents. And once I suggested for the pediatrologist, I told him that the children can take the therapeutic sessions. They have this service. But what about the parents? How can they be out of the trauma? Because the diagnosis, it's a long life, it's a life, it's an infinity.
Right. It's a chronic disorder.
For life, exactly. So I was watching from the field work, how parents get the diagnosis, and it was very traumatic for them. And the neurologist once there told me, Ray, you are right. You are talking, because even if the social worker accompanies the parents for 2 to 3 sessions, I believe, from what I continued learning, I believe that emotions and how to come out from that phase, for parents to be in a neutralization period, it gives them a very good space to continue the journey with their children, because we believe in early intervention. And the basic in the therapy is communication. So if parents are in their zone with the trauma they got, and the children are in their own zone, there is a very big lack. And from there, I started digging more in my freelancer coaching programs and services, because I believe in raising up awareness in parents and guiding them, because we are talking in a very deep informations regarding sensory input, regarding a lot of, as my colleagues here discussed, it's very integrated issues. We're not talking about one very simple guide issue, and sometimes there is autism with another diagnosis. So I truly believe from inside that if there are programs guiding parents, we can reach children with a very nice intervention programs. And of course, my vision also is to go for what you concluded is for prevention. But I'm talking meanwhile about the therapeutic journey. Thanks for listening.
So that's a very important remark, and that's very true. The way that I'm teaching physicians and trainees, when you're talking with the family and giving bad news, and it can be about autism, it can be about intellectual disability, or even ADHD, which we consider like something easy, but it's also very bad news for the parents. So I'm teaching them that your purpose in this discussion is that you're breaking the dream of the parent about their child, but you have to build them a different dream, because there are many things to dream about successes, and to tell examples about people that succeeded, and to look at the things that the child can do and not what he cannot do. And another remark, that what you're talking about the parents, it's very important to give them support, because they're caring for the children. So it's very important to give them support. One of the ways that I'm supporting parents is by giving, like you said, sessions for the parents and how to work with their children, but also support for other parents. I have like a network of parents that are very nice, and they already are after this journey with their children, and they allowed me to give them their contact to parents that are now receiving the bad news, to talk with them and to discuss. And that's a lot of support that it doesn't cost anything, just to build this sort of network of parents that are helpful. And also there are a lot of like associations for parents that can be very, very helpful for all those genetic disorders. Each one has a parents association that is very helpful in helping other parents and giving them hope, because that's very important to give them hope. And another thing that is very important that I'm telling the parents, that you have to think about caring for your child in the way that they tell you when you get into an airplane. What do they tell you about the oxygen? When they show you the mask, they tell you first put the mask to yourself and afterwards to your child. So it's important to give strength to the parent to take care of the child. So to give the support first to the parent, and then this is very helpful to the child. So thank you. That's a very, very important point.
Amjad?
Thank you, Jafar. Thank you, Leader, for the presentation. I will ask maybe technical question, not medical part, because we have enough doctors in this session. Okay, so as you are working in Maccabi, so you mentioned that you are using big data and machine learning. So how you think that we have enough data mature that can be used in the prediction and like doing like more planning for like autism? Used as Maccabi. So what about other insurance companies? What about the rest of the hospitals? How you are doing some linkage with Charles Sadek, Aline, and the others, the other hospitals? So do you think that we have enough data, so like a data dictionary that we can use for our startup as well? So we can use this big data to support us.
I believe a lot in collaborations. As much data as we can have, it's very important. As I mentioned, the Tipot Halav, it's national data. There are ways to get approvals from Misrad HaBriut, from Ministry of Health, for getting data from hospitals, from many, and it's very important, though, to think about how we protect the data and the identity of that's all the a lot of work done in the way of using the data and protecting it, because upfront the patient didn't give us the approval to use his information. So there is a lot of debate about how to protect this data and how to use it, that it will be really useful. But it's very important to do as many collaborations. I'm also, there are big differences between countries, not only between insurers in Israel. Yes. So also international collaboration is very important. The care is very different in different places. So it's very important to use data wisely. It's true that there can be very big data, but not always it's so deep, not always is so good. So it's very important to be careful and to try to look at different populations.
Thank you. Zafir?
Zafir.
Yes.
I have a comment about what you and Ramiz talked earlier about what the influence of the social media and technology on autism. And what you said that it helps, but in fact, I was confused a bit, because once I heard a report from educational psychologists and other experts saying that normal people, when they watch a lot or follow the, let's say, mobiles and all these new media and digital media facilities and devices, they are, let's say, potentially they will get this disease or be autistic people. So that was confusing. And there were another thing that I wanted to ask you, but my colleagues asked, and they are already, I got the answer already. Thank you.
So there is a lot of debate about it and maybe different views, but my view in terms of development, like I'm talking about young children, I don't think that devices like phone, television, and they're causing autism. I think that kids that will have autism like it more than usual kids. So they have a tendency towards it. So that's why I said I tell the parents, don't give them screens. By the way, the American Academy of Pediatrics said no screens until age of 2 years for all children, but especially if they have some issues. But I don't think it's because of the screens, but the screens reinforces their problems, like enlarges their problems. The other problem is the communication of the parent. Because if I see a parent and the child is trying to call him and the parent is looking at his phone and not communicating with the child, that's the main problem. That the child is not getting enough communication from other people because they're in the screens. But I don't think the screens are the disease. I think they are the symptom of
I
the life.
believe. Yes.
We'll have to finish, right?
Yeah, thank you, Prof. Lida. Thank you very much for the great session. Appreciate it. Thank you.
Enjoyed very much. Thank you all.
Thank you. Thank you. Thank you. Thank you.
And be in touch. Bye bye.
باي باي. تيك كير. احنا فعلا المفروض كان اللقاء الثالث بس اعتذرت بروف ميخال. راح نسوي السيشن اللي حكيت معها هلا بشويه، هي خارج هي بالخارج، فكرت الاسبوع القادم. راح نرتب ان شاء الله اللقاء للايام الجاي، يعني راح نخبركم ان شاء الله غالبا راح يكون بشهر 9 لانه سيشن كثير مهم جدا بالذات للستارت ابس في موضوع الاي اي وبالهيلث بشكل كامل. بس بدي احكي شغله اغلبكم قبل ما نطلع. احنا اللقاء الجاي عندنا يوم الاربعاء ان شاء الله للليدرشيب وللانكيوبيشن. الاسبوع القادم بالتالي عندنا راح يكون في عندنا سيشن كثير مهم جدا مع دفنة بخصوص البرزنتيشن. طبعا الانكيوبيشن هذا اللقاء لكم، وبالليدرشيب وغيرهم اهلا وسهلا مرحب فيكم. اللقاء راح يكون عندنا هون رجاء من الجميع انه يكون البرزنتيشن محضر كدرافت اتليست، لانه دفنة راح تشتغل معكم بشكل كامل ابتداء من